Welcome to our talk about managing the emotional impact of cancer. This talk is part of our health and wellbeing education series for people affected by cancer. It is based on research and includes advice to support you before, during, and after your treatment. The other videos in this series are about being active, healthy eating, improving your sleep, and managing fatigue. You may choose to watch them separately or together, as the advice in one video can help you to manage some of the concerns raised in the other videos. For example, managing your emotional well-being can improve your sleep. If this talk raises any issues or questions you'd like to discuss further, you can join our Managing the Emotional Impact of Cancer workshop. Details of this are at the end of this talk. You may be feeling a range of emotions: shock, anxiety, fear, anger, guilt, sadness, or feeling alone. You may feel worried or uncertain about things that happen day to day or about the future. This can be unsettling. There's no right or wrong way to feel. It is normal to have different emotions at different times and of varying intensity. You may also notice physical effects such as tiredness, changes to your appetite, pain, a lack of interest in sex, or poor sleep. Experiencing any of these can further impact your emotional well-being. Although at times your emotions may overwhelm you, there are some things that you can do to help. To start with, it's important for you to recognize and acknowledge how you are feeling at any moment. Once you've done that, you can take small steps to help yourself. Talking to someone can help, although sometimes this can be difficult to do. You may worry about talking about how you're feeling because it makes it feel more real. You may worry about upsetting someone, or worry that they might not know what to say to you. You may feel different emotions and struggle to explain how you feel. If you're able to overcome your worries, talking about them may help. It may stop you from feeling alone, help you to solve a problem or make a decision, or help you to feel less frightened or anxious. It can also help you to feel supported. Is this something you find hard to do? Do you find it difficult to talk about what you need from others? Are you the type of person who usually supports others? If the answer to any of these questions is yes, it may be harder for you to recognize if you need support yourself. Pause this video and spend a few minutes thinking about who you'd like to talk to and what you'd like to say to them about how you're feeling. We can talk about this more in our workshop. To find out how to book a place on the workshop, contact a support and information specialist. The contact details are at the end of this talk. You may have a close friend or family member you can talk to, or you may find it easier to talk to a healthcare professional, such as a support and information specialist, nurse, or doctor. You could also talk to someone who works on a charity helpline. Talking to someone else who has cancer can help because they may be more able to understand how you feel. Some cancer charities can match you with another person with cancer, or you could attend a support group. If you have ongoing emotional issues that you can't resolve, ask your doctor, nurse, or support and information specialist to refer you to a counsellor or psychologist. There are some things you can do to feel more in control, which may lift your mood. These include healthy eating, being physically active, and sleeping well. You can get more information about these topics in the other videos in this series. Distracting yourself can help you to cope better in the short term. For example, watching TV, doing a puzzle, origami, or reading a book. If you feel stressed or low, you may spend less time doing things that make you feel better, so remember to do things that you enjoy. Complementary therapies can help to relieve stress, improve your sleep, and manage side effects of treatment, which can all help you to cope better. The complementary therapies we currently offer include aromatherapy, massage, reflexology, and relaxation. Details of how you can be referred to our complementary therapy service are at the end of this talk. Doing mindfulness, meditation, or relaxation exercises can help your mental health. Mindfulness helps you to focus on the present, stop worrying about the past or feeling anxious about the future. Meditation helps your mind to be clear and your emotions calm. Relaxation techniques can help to calm and relax your body and mind. They are particularly helpful if you feel stressed or anxious or have trouble sleeping. Although it can help to be positive, it is not easy to keep positive all the time. If you try to stay positive all the time, it may be harder for you to recognize the challenges you're coping with. It is okay to have days when you don't feel positive. And if you feel low or worried, it can help to acknowledge these feelings. Sometimes you may find it difficult to find anything to be positive about. Research shows that finding one thing you're grateful for can help to lift your mood even during difficult times. Pause the video for a minute and try to think of something you're grateful for. It could be that the sun is shining today, or you just spoke to a good friend. If you are struggling to do this, contact a support and information specialist. The contact details are at the end of this talk. Starting treatment can be a challenging time. You may be coming to terms with your diagnosis, managing hospital appointments, and learning new things about your cancer and treatment. Getting accurate and reliable information can help you to feel more in control. It can also help you to make the decisions that are right for you. Ask your hospital doctor or nurse or a support and information specialist to give you more information about the things that are worrying you. Only use trusted websites like Macmillan Cancer Support, other UK cancer charities, or the NHS. If you are starting chemotherapy, watch our 3 chemotherapy education videos, which give you information about what to expect, how to manage side effects, and the emotional impact of cancer treatment. Information about where you can watch these videos is at the end of this talk. If you have practical concerns, talk to friends, family, your nurse or doctor, or a support and information specialist. The time after your treatment has finished can also be challenging. You may miss the regular contact you had with your clinical team. It may be difficult to know how to move forward, especially if you are still dealing with treatment side effects. You may feel pressured to go back to work or to look for a new job. You, your friends and family may expect you to recover quicker than what's realistic. If you are struggling to cope after treatment, speak to a support and information specialist. They will give you advice and information about groups and courses specifically for people who have recently finished treatment. When you're feeling overwhelmed, it can be difficult to find things that will help. If you've tried something before that has helped your emotional well-being, it may be useful to try that again now. If not, how about trying one piece of advice from this talk that you feel may help? If you struggle to think of anything that could help, speak to a support and information specialist. Or you could join us for our Managing the Emotional Impact of Cancer workshop. Details of where you can get more information about the workshop are at the end of this talk. Further support is available if you need it. Call our helpline on 020 3447 3816 to speak to a support and information specialist. Join our Managing the Emotional Impact of Cancer workshop. For upcoming dates, call our helpline or visit our website uclh.nhs.uk/MSIS. Ask your hospital doctor or nurse or a support and information specialist to refer you to a psychologist or counsellor. Ask a healthcare professional to refer you for complementary therapy. Visit Mind's charity website, mind.org.uk. Read the Macmillan Cancer Support booklet, How Are You Feeling? Order online from b.macmillan.org.uk. Download a mental health phone app recommended by the NHS. nhs.uk/apps-library. If you're about to start chemotherapy or targeted therapy, watch our education videos. uclh.nhs.uk/chemovid.